With the projected increase in hospitalizations across the province, though, the Ontario government announced on Friday that all hospitals should be prepared to accept patient transfers from outside their region. Oakville Trafalgar Memorial Hospital has already been doing just that. We spoke with Halton Healthcare Senior Vice President, Patient Experience and Chief Nursing Executive Judy Linton for an update.
So we made the decision last week to start to ramp down our scheduled surgeries, not related to anything in the field hospital, but because of the increasing pressure on critical care across all of the hospitals, particularly in the GTA, we really need to be able to provide that support to other hospitals. So we have been taking patients transfers from other hospitals since mid-November. We've now taken 91 patients from other hospitals surrounding us to try and help them with their trying to balance basically the load of COVID patients across the GTA. So with that and with the increasing pressure on critical care, the patients that were coming to us are all COVID positive patients now, and some of those patients will end up in the ICU. So we really made the decision that we needed to move some of our staff from the operating room and from other areas to help in the ICU. So what we're doing in our ICUs is working in what's called team-based nursing. And so the nurses, there's an ICU nurse who sort of oversees that team, and they look after a group of patients together instead of the typical sort of one nurse to one patient ratio that you would normally see in an ICU. And our staff have been amazing because we've taken them out of their area of comfort and put them into an ICU team, and they get orientation, they get training, they get support, but it's still taking them out of their comfort zone. So our staff have been incredible in stepping up and allowing us to do that, because we have to be able to deal with the pressure and the surge on critical care that is taking place now and is likely to increase.
The Oakville ICU is currently running at 115% capacity. Linton shares the plan as the number of COVID-19 patients continue to rise.
What we've done is that we have our regular ICU space, and then we have space that we can surge ICU patients into on other floors. There is a provincial stockpile of ventilators, for example, and so you can access that provincial store of ventilators. So equipment is certainly for us, I can't speak obviously for other hospitals, but for us, we're in pretty good shape where that is concerned. I am a critical care nurse by background, and speaking as a critical care nurse, the thing that I worry about the most is that staffing and making sure that we can support our ICU staff. It's very stressful on our ICU staff, our physicians, our nurses, all of the people who work in the ICU. To be handling this volume and this pressure. And so, we're doing everything we can to support them by bringing in other staff and trying to function in the teams. It's certainly challenging. I mean, there are ICUs that are functioning at 125% of their normal capacity, and that's pretty significant. So we're at about 115% in our ICU here in Oakville, and that sustaining that for a long period of time is challenging.